Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of ENT is rehabilitation of hearing impaired. In our previous lectures, we talked in detail about the types of hearing loss, and then we talked about the management of hearing loss. And then today we will talk in detail about how we can rehabilitate the person with hearing impairedness. So we divided our lecture into 5 sections. In the first section, we will talk about different instrumental devices for the hearing impaired individual. And in this section, we especially talk about rehabilitation for communication. Rehabilitation for communication is the main purpose of the management of or rehabilitation of hearing impaired individuals, because if the hearing impaired occur or loss of hearing occur prelingually, then the communication hindrance is the main problem. If it develops after postlingually, then it's not as serious a problem as compared to the prelingual individuals. So rehabilitation for communication, and then we will talk about the different types of hearing aids and its disadvantages. And then thirdly, we will talk about the contralateral routing of signals. So contralaterally, as the name shows, we will talk if the hearing is from the contralateral side, how it works. Then in the second section, we will talk about the bone-anchored hearing aids. So in this, we will talk about what is the candidacy profile, what are the and who are the individuals who can benefit from this bone-anchoring type of hearing aids, and then what are the indications for this method. Then the surgery and some complication associated with bone-anchored hearing aids. In the third section, we will talk about the implantable hearing aids. They are actually implanted, and they are piezoelectric and electromagnetic hearing devices that generate electromagnetic signals and that cause production of sound. And then we will talk about vibrant sound bridge device and also procedure and advantages of implantable hearing aids. Then in the fourth section, we will talk about the cochlear implants. Cochlea is the snail-shaped structure present in the inner ear. Inner ear is mainly responsible for any damage of the inner ear, or cochlea is responsible or leads to sensory neural type of hearing loss. So in this, we will talk about what are the components, functioning and candidacy profile of cochlear implants. We will also talk about the outcomes and evaluation and surgery, mapping and complications of cochlear implants. And then in the fifth and final section, we will talk about the auditory brainstem implants. What are some assistive devices which can help the hearing impaired individuals, and how we can train the individual with hearing impairedness. So all this will be covered in our today's lecture. We will talk about these rehabilitation procedures or steps in detail. So to learn more about this topic, keep watching sqadia.com.